Now for our What in the World segment. Tens of thousands infected, hundreds dead, more than 24 countries affected and counting. That is the damage inflicted so far by the deadly coronavirus that cropped up in China in December and shows no signs of dying down. The WHO has called it a global health emergency. Many international airlines have stopped flying to China, and governments have chartered flights to evacuate their citizens from that country. But the most fascinating part of this story is the Chinese government marshalling its prodigious state machinery to enact what is believed to be the largest quarantine in human history. It centers around the city of Wuhan in Hubei province, where the virus first appeared and where the outbreak is centered. There, most businesses and schools are now closed, highways are nearly deserted, public transportation has shut down, and routes to the outside world are all but cut off. Wuhan has about 11 million residents, but you'd never guess that looking at the streets today. A mysterious disease began to come into public view in late December when a doctor messaged his friends that there was an infection in his hospital. The infection was believed to be tied to a seafood market. Wuhan authorities promptly shut down the market, but also called the doctor into the police station and reprimanded him for disrupting social order. The central government didn't take control until January 20th, when it ordered the quarantine. In the days that followed, gymnasiums and exhibition centers were turned into makeshift hospitals. Workers and police were deployed to take people's temperatures as they entered public places and opened shops. Workers sprayed down streets, hotels, even people with disinfectant. The scale of China's lockdown is impressive, but it was also delayed, which accounts in part for the widespread of the disease, the crowding of the hospitals, and the numbers of deaths in Hubei, as the Chinese news outlet Caixin reported. Between January 23rd and February 4th, the official death toll in Hubei province grew by a factor of 20. And included in the death toll now is that doctor who first blew the whistle on the disease. Faced with the hospital crowding, the government devised an only-in-China solution. It set out to build 2 new hospitals in Wuhan in under 2 weeks, deploying thousands of construction workers using prefabricated units. According to state media, both opened this week and each was staffed with more than 1,000 military medical workers. The precautionary measures have spread beyond Wuhan. Almost 60 million people around the country are under lockdown. Many shops have shuttered in Beijing and Shanghai. Macau closed its casinos. The government has sent drones around the country to tell people to wear masks. The response has become a matter of patriotism. This week, an editorial in the People's Daily called for a people's war against the virus, entreating citizens to rally around the Communist Party's Central Committee and Xi Jinping. Now, this is an impressive response and could probably only happen in China. But that doesn't mean it's always the smartest strategy. Some of the more stringent restrictions stigmatize the ill and restrict personal liberties. According to Caixin, early last month, Wuhan police, quote, punished, unquote, 8 people, most of them doctors, for rumor mongering because they were actually just spreading news of the outbreak. Still, these are uncharted waters. We should all watch closely what is going on in China and learn from it. The world is more connected than ever before, and so we are likely to see more of these kinds of crises in the future.